5 danger warning signs of a brain infection. Brain infections are quite infrequent in comparison to other health concerns, with a global incidence of 400 per 100,000 persons between 1990 and 2016. Nonetheless, despite its rarity and amazing progress in the health sector, HIV remains a top cause of mortality, particularly in developing nations. The command center for the entire body, i.e., the brain, has it all figured out, from breathing to complex judgments. But how do we determine whether something is interfering with its normal operation? It's easy. All you have to do is keep an eye out for the following warning flags before embarking on your mission. Brain health is an operation. 1. Have you begun to lose your basic cognitive abilities? Consider the following. When your phone rings, you hear it, this is perception. You choose to answer it, this is decision making. You lift the receiver, this is motor skills. You converse, language skills. You read the tone of the other person and interact with appropriate emotion, this is social skills. All of them are classified as cognitive function. Consider this: what if these fundamental brain-based talents are compromised? You would no longer be able to function normally. In severe circumstances, you may get dementia, an illness that causes a significant deterioration in an individual's cognitive functions such as memory, abstract reasoning, social and visuospatial skills. The question now is, what causes dementia? There isn't one specific cause for it. Instead, it could be caused by a number of factors. And Alzheimer's disease is one of the leading causes, accounting for over 80% of all cases. This occurs because Alzheimer's disease causes a buildup of 2 harmful structures in the brain, which disrupts its normal functioning. The first is called amyloid plaque. These are beta-amyloid clumps, which are important proteins in the brain. However, when these proteins clump together and form large groups known as plaques, they block communication between nerve cells and make it difficult to pass on essential information. Because these buildups are usually evident in your brain's memory section, the hippocampus, your ability to remember information is limited. Neurofibrillary tangles are the other. This time, it's another protein called tau, which is likewise in charge of keeping the brain's microtubules stable. Microtubules transport nutrients and information between cells. When tau is harmed, maybe as a result of a genetic mutation, the fibers get twisted, resulting in neurodegeneration. Dementia can also be caused by nutritional deficiencies, in which your body lacks vital nutrients such as vitamins, bone, and B6. Meningitis, brain abscess, and encephalitis are all central nervous system infections that might impair your cognitive abilities. 2. Headaches that won't go away. When you have a terrible headache, many of your daily tasks are placed on pause. Not only are they vexingly unpleasant, but they can also be indicative of underlying brain disease. 98% of headaches are fundamental in nature and can be caused by simple lifestyle factors such as a disturbed sleep cycle, excessive alcohol intake, stress, wrong eyewear, being overworked, bad posture, and an inadequate nutrition. Secondary headaches, on the other hand, are rather infrequent, and their timely detection is critical since they can be life-saving. Some of the causes of these painful headaches include fatal brain illnesses such as meningitis and encephalitis. Your brain and spinal cord are surrounded by 3 layers of membranes called meninges. The dura mater is the outermost layer. The arachnoid is the middle layer, which is made up of a web-like structure filled with fluid that acts as a cushion to protect the brain, and the pia mater is the innermost and most delicate layer. When these layers are attacked by bacteria, viruses, fungus, and parasites, they enlarge, resulting in a disease known as meningitis. Inflammation is likely to develop into another severe medical disorder known as encephalitis if this attack spreads to the entire brain. This can happen through direct infection or by an immunological response to an infection. Well, your body has its own defense mechanism against infection, which is known as the immune system. When an unwelcome intruder enters, your body responds by disbanding its army of immune cells, which then battles the infection-causing substances and pushes them to flee. And, like combat scars, this can cause modest inflammation. So yes, a severe headache can be a symptom of a serious brain condition. 3. You've just started getting seizures. Anything that produces structural or functional changes in the physiology of the brain can induce a seizure. Seizures occur in about 5% of persons who have central nervous system infections. Herpes simplex, HIV, bacterial meningitis, and brain abscess are examples of these infections. Seizures occur as a result of the infecting organism's direct invasion of brain tissue, the creation of toxins by the invader, or an immune system reaction that results in inflammation. Any of these 3 causes can result in the collapse of the blood-brain barrier or possibly cerebral edema or brain swelling. What if you have a history of seizures? It's possible that it's due to epilepsy. It is the most frequent major neurological disorder, affecting 70 million individuals worldwide, and if left untreated, can result in lifelong brain damage. Seizures intensify over time, eventually leading to unconsciousness and death. Unprovoked and repeated seizures not only harm your health but also lower your quality of life. You can no longer drive easily or participate in hobbies such as swimming and traveling since you would require assistance for most regular activities. Seizures can also occur for other reasons. Abscess in the brain. Fungi, viruses, and bacteria enter your brain via a wound in your head or an infection elsewhere in your body. The accumulation of pus and dead cells causes your brain to expand. A head injury, a weakened immune system as a result of HIV or AIDS, immunosuppressive medicines used in chemotherapy, and recurrent sinus and middle ear infections are all possible causes of brain abscesses. 4. You are exhausted and sick. Are your mornings boring and drab? Is your everyday routine hampered by persistent exhaustion and weakness? Do you have random chills and a recurring fever out of nowhere? If the answer is yes, it is time to act and take this situation seriously. It's possible that you have a brain infection. And don't think that by exhaustion, we only mean physical weakness. We're also talking about cerebral fatigue. Mental exhaustion, on the other hand, can be a nightmare. You tend to give up on any type of task that requires you to use your intellect. Your nerves are under constant stress. Minimal thinking appears to be too much for you. And while you're fighting this lonely struggle in your head, you appear gloomy and irritable to the rest of the world. And what about those weird chills you keep getting now and then? And what about the fever, which makes unexpected appearances and quick retreats? Brain infections, such as encephalitis and meningitis, generally begin with fevers and are frequently accompanied by headaches and a variety of other symptoms. Fever is also a common medical symptom of a brain abscess, occurring in about 55% of patients. But did you know that identifying a brain abscess takes 8 days following the onset of symptoms? That is correct. Because of the ambiguity of these symptoms, determining cerebral inflammation can be time-consuming. After all, because fever and exhaustion are non-specific symptoms, they frequently mirror other conditions, making brain infestations difficult to diagnose. 5. You have communication issues. It's normal to be unable to talk in a busy space or to have difficulty understanding speech at times. But what if this strained communication continues? And what is the root cause? It could be a brain disease. Aphasia is a medical word for this type of language disability. It is caused by injury to the brain's cortical center. Neurological illnesses, brain injury, and cerebrovascular accidents caused by blood clots and ruptured blood vessels in the brain may be the cause. Yes, it could be brain cancer. If the tumor is in the area of the brain responsible for language, your speech will most likely be impaired. Depending on the extent of the damage, this impairment might range from minor to severe. Multiple sclerosis, a neurological disorder, has been linked to reduced speech in affected individuals, according to research. Multiple sclerosis develops when immune cells assault myelin, the coating that surrounds nerve cells. This severely disrupts communication between your brain and the rest of your body. Other probable factors include vitamin D insufficiency and genetic inheritance. Now comes the challenge of how to keep these brain infections at bay. Neurological disorders can be fatal, and the majority of their specific causes may not be identified without additional testing. Doctors advise, however, that keeping your surroundings neat and tidy, washing your hands regularly, maintaining basic hygiene, eating a nutrient-rich diet, and engaging in regular exercise can help you deal with them to a large extent. Remember, if you suspect you have a brain infection, don't ignore the symptoms. Act immediately and consult a doctor. Do you want to know more about your brain? Please let us know in the comment section below.